Uh, while I think we wait for everybody, I can start off by welcoming everybody. Good evening, all. Thank you for joining us. On behalf of Niramai, this is Dr. Lakshmi Krishnan welcoming you all to the monthly webinar series. We usually have this series on the first Friday of every month, but with the International Yoga Day falling on the Monday, we thought it would be very helpful to actually have a webinar on the role of yoga in symptom management of cancer. I'll take this opportunity while we wait for others to join in to quickly talk about Niramai. For those of you who have joined us for the first time, Niramai has developed an innovative AI-based solution to detect breast cancer early. So our mission is to save lives. Most of you would know that breast cancer is the one of the top diagnosed cancers in the country. Not one of the top, sorry, it's the top diagnosed cancer in the country, with over 180 women, 80,000 women detected with breast cancer in just 1 year, and that this is 2020 statistics. And we have almost 90,000 women dying of breast cancer a year, and you can see that the survival rate is less than 50%. Uh, And that tells us that for every two women who are diagnosed, newly detected with breast cancer, one woman succumbs to it. So is there a solution? Yes, there is. Early detection is the key to survival. There are several hurdles for early detection today. Most important being lack of awareness, that people do not know that there are tests for which we can get ourselves screened of breast cancer. While 2 billion women need to be screened every year, less than 200 million breast imaging tests are done. And that is because standard diagnostic modalities like mammography are only in the tier 1 and tier 2 cities, and which makes it more difficult for people to access the screening technologies. There's also the fact that we could manufacture both devices, but we cannot manufacture specialized human resource. As the present COVID pandemic has put that into context, that we need specialists, and in this case, a radiologist, and who cannot be manufactured. So we do need tests that can be performed by anyone with minimal training, so that the specialists, so that the radiologists can focus on those who really require care, and focus their energies on that. That apart, the current modalities also have are radiation based and have pain. And the other hurdle and major hurdle is the technology limitation. That is, the present modalities have a low sensitivity for detecting breast cancer in women less than 45 years and those with dense breasts. The need is to have a test that kind of tick marks against all of these hurdles. And that's how Niramai has developed this novel solution called Thermalytics. It is an AI-based solution, and it is meant to detect early stage breast cancer. In fact, it can detect a cancer long before a lump is felt. It's painless and radiation free. It's non-contact and privacy aware. Here you can see our technician who's sitting outside. Inside this, very quickly set up compartment kind of a thing. The person, the woman who needs to be screened, as well as the device that is used for screening is inside. So there's absolutely no contact between a technician and the patient. Also, we don't even see the patient. This especially is even more COVID conscious, if I can use that word, because there is this distance, inherent distance that is maintained while performing the test. The test is affordable, and the device used for screening is a very small, portable and very light in weight. So that's our device, which is powered by machine learning. And then, of course, it's applicable to women of all ages and all breast densities, and even men too. Because it's portable and it's easy to carry, we are able to overcome the last hurdle of even accessibility. Instead of patients coming to the hospital, Niramai solution can now be taken to homes. And for whatever reason it may be, you don't want to step out because of COVID. You want to be at your home, at the comfort of your home, to when you're undressing, whatever may be the reason. We can now provide you a screening of breast health, which is contactless, and which ensures your privacy in the comfort of your home. With that, I think small brief about Niramai. Uh, let's start our webinar today. With the Ministry of Ayush, we are organizing this webinar of role of yoga in symptom management of cancer. The aim of the webinar is to create awareness among people and remind them about issues that are vital in cancer. Several studies have demonstrated that yoga can improve strength for people suffering from cancer symptoms and side effects. Today, we have very eminent speakers amidst us today to take us through this awareness session. I would request Dr. Tanveen to introduce the esteemed speakers, Dr. Raghavendra Rao and Dr. Sapna. Over to you, Tanveen.
Hello. Thank you, Dr. Lakshmi, for taking this all, starting this all. And Dr. Raghavendra Rao, we welcome you on behalf of Niramai for this webinar today. For everyone who has joined us, Dr. Raghavendra Rao holds a PhD in Yoga and Life Sciences from Swami Vivekananda Yoga Anusandhan Samasthan University, Bengaluru. He has completed several research projects in rheumatoid arthritis, pre-diabetes, diabetes, cardiovascular disease risk prevention, the use of both yoga and naturopathy in interventions. He has written many international research publications and book chapters on yoga and its application. He is a member of the Ministry of Ayush, Unani, Siddha, and Homeopathy Research Portal, Government of India. He has also won awards in the fields of Ayurveda and yoga research. We welcome you, sir. The second speaker we have today for yoga is Dr. Sapna. Dr. Sapna K has obtained her Bachelor's of Naturopathy and Yogic Sciences, BNYS, and has also completed her MD in Clinical Yoga. She has worked on yoga research projects and is currently a yoga consultant at HCG Cancer Hospital, Bangalore. She has also been a speaker in various international and national webinars on yoga in cancer. Thank you so much, Dr. Sapna and Dr. Raghavendra, to join us today. Over to you, Dr. Lakshmi.
Thank you, Dr. Tanveen. We'll begin this webinar session with Dr. Raghavendra's session. Through different yoga guidelines, Dr. Raghavendra will highlight the importance and contribution of yoga to women's health. This will be followed by a question and answer session. And after that, we have a rejuvenating yoga session. I'm told it's called desk yoga that will be conducted by Dr. Sapna K. As of now, Dr. Raghavendra, over to you, sir.
I need to do some presentation, so can I go ahead with it?
So you can share your screen now. Thank you, sir.
So I just wanted to go because Niramai is also a preventive healthcare and works in the area of prevention. I thought I'll also touch a bit about what prevention in oncology really means and where do we go from here. Because most of my patients who come to the hospital whom we have been talking to, they always ask this particular question. Doctor, I don't drink, I don't smoke, I am an ardent devotee, I pray, I eat only vegetarian food, still I got cancer. Yeah, this is a very, very important and a pertinent question for any woman or any man at their adulthood to ask this question to the doctor. And this is what many of them would really want to ponder. What went wrong? Where did it go wrong? Okay, where did I falter? We don't have answers to all these questions. And we'll learn about this as we go along with this lecture. Okay. What does cancer really mean to you? It's very, very important. Many of them, think about cancer as a very, very terrifying illness, probably because of the media and because of the films, which have depicted cancer as a terminal disease kind of thing. And they have also shown gory incidents of the hero or the heroine dying of cancer, vomiting blood and whatnot. Okay. But you should always understand that cancer, though it is there in the body, it is a disease which is chronic, is there for life. And it needs to be taken care of just like any diabetes or hypertension. Okay. The only thing here is that it should be managed with more acute kind of medical care rather than diabetes or hypertension where you just have to take a pill. So most of the time, this cancer is associated with fear and death and as well as terminal illness. So what does the cancer really look like? It's just a mass of tissue. But if you see this particular mass of tissue, you may probably look at this as something like an alien environment. The alien is hatching its egg, or some sort of a thing from a fiction movie, probably which you might have seen before. So exactly that, and cancer looks exactly like an alien. So if you look at the blood vessels surrounding this tumor mass, these blood vessels are produced by the cancer tissues themselves. These are abnormal blood vessels. They are tortuous. These are leaky blood vessels, and they are there to supply blood supply to the cancer. So when the cancer starts harboring in any tissue or any part of the body, it starts producing its own blood vessels. It starts trying to use the same blood vessels to migrate to other parts of the body. And these blood vessels are abnormal, they're leaky and porous as well as I said to you. And they also form clots. Okay. And this is one important hallmark of cancer. Cancer can survive anywhere and any part of the body, and any tissue in your body can become cancerous. Okay. So cancer can affect people of all ages. A small newborn child can have a retinoblastoma or any sort of tumor. Okay, an old person will have many multiple types of cancers, lung cancer, esophageal cancer, breast cancer, what not. So cancer, the uh, uh, the proclivity of cancer to different ages also depends on the type of cancer. We tend to have more hematological malignancies in lower end of the age. We tend to have more solid malignancies in the upper end of the age, and this is true for most of the cancers. And very importantly, when you say cancer or when you say tumor, both are different. Tumor is one which is very localized. You have fibroadenoma of the breast, and Niramai's technology will also helps to identify a benign tumor from a malignant tumor as well, or malignant cancer as well. So tumor is in the same local site. It doesn't spread to other parts of the body, because cancer can spread to any other tissue or any other part of the body. Okay. So cancers, how do these cancers develop? So all the cells are always dividing. Cells are always having a life cycle. They keep on dividing. They keep on dying, and there is a balance which is maintained between the division and your death. Okay. And sometimes what happens, there are certain switches which are there in the genes which help in switching on, which when switched on can lead to a cell death, or when it goes abnormal can lead to abnormal proliferation of the cells. These are called DNA repair genes. Okay, when these genes are going haywire, when these genes become abnormal, they become non-functional, then the proliferation, the checking of the cancer is no longer there. We have, for example, P51 gene. Okay, so P53 gene, which is very important, called as guardian of the human genome. So when the cell is tend to multiply, there is a DNA strand within the cell of the cancer, the nucleus of the cancer. It replicates into two. It starts dividing the cell, and cells start proliferating by mitosis. Now, when this DNA strand is dividing, there can be abnormal damage to the strand in the DNA, and if it is not repaired properly, and if that particular strand of the DNA is damaged, this key gene is there called P53 gene, then this gene doesn't allow the cancer to really, this gene doesn't allow the cell to really proliferate. And if this gene is completely lost, then the checking of the cell, the damaged DNA never happens. The mutated DNA gets passed on to the offsprings, and that's how cancer develops. So more damage and strand breaks in the DNA, the removal of the nucleotides inside the DNA. So all these things are caused by what? By smoking, by taking non-vegetarian food, by uh, having pesticides in your food, having preserved foods, canned foods. All these things may also have carcinogens, harbor carcinogens, and this will enter into the body. There's no way of it going out of the body, and they go into the cells and tissues and damage the DNA. And more immune assaults or damage to the DNA lead to more and more susceptibility of the particular genes, different areas of the genes. And once if P53 is completely damaged, that's when you have a problem. So these are called as oncogenes, and if these get damaged, then you have a problem. So you must also be wondering why elephants don't get cancer. But does anybody know the answer? Why elephant doesn't get cancer? Reason, because a human genome, a human body, especially humans, do have one pair of P53 genes, okay, in chromosome number 17, whereas if you see elephants, it has got 256 pairs of P53 genes. Okay, so if one of the P53 gene is damaged, the other one is always there. If both are damaged also in humans, you have a problem. You can get cancer. Whereas it doesn't happen in elephants. You have so many genes there, 53, which are guardian of the genomes, and they never get cancer. Okay, this is a very important aspect of it. So there is the cells which are always dividing, cells which are always getting damaged, and there is a signal which is developed inside the cell, which switches the cell to undergo a cell death called apoptosis or autoapoptosis. And last year's Nobel Prize was also given to the scientist who did a lot of work on autophagy, basically. That is automatic cell death, which is known to improve lifespan because it doesn't cause inflammation, it doesn't cause necrosis. The cell automatically dies and gets forward itself inside. Okay, so that is a very important aspect of life preservation and conservation in human body or in any living matter, for that example. So this autophagy is one important productive mechanism. Sometimes when the damage is so severe, over time, autophagy doesn't happen, necrosis happens, leads to inflammation, leads to cancer. Okay, so now I said to you, there are a lot of mutations which are happening there. And some of these mutations are carried on to the generations. These are called hereditary cancers. Like you can see in the family, you can get cancers. Like there's a mother having a breast cancer, an aunt is having a breast cancer, the daughter is also having a breast cancer. Breast cancer, ovarian cancer, uterine cancer. These are some of the cancers which are usually run in families. Okay, these are called hereditary cancers. And these constitute about 5 to 10% of all cancers. What are the risk factors for cancers? There are modifiable risk factors, there are not modifiable risk factors. As I said to you, genetic predisposition you can't modify. Mutations which keep on occurring at random, you can't modify. Viral infections which can enter inside the cell and modify the genes, you can't modify. So, for example, human papilloma virus is more known to cause oral cancer as well as cervical cancer as well. Okay, these are not modifiable. What is modifiable is tobacco, lifestyle such as obesity, stress, substance abuse, overweight, dietary modifications, exposure to radiations, and occupational hazards. These are all modifiable risks. So this is how a cancer cell looks like. A normal colon tissue, intestinal tissue is very beautifully organized. All the cells are in a proper disciplined manner. They know how to sit in their places in the classroom. Same way here, you can see here, they're completely disorganized. Okay, they just keep on growing and proliferating. They don't know how to behave, and this is how cancer cell looks like. Now, if there is a cancer inside this part, it's a part of the cell. This part of the cell starts to overgrow. Then when it starts overgrowing, there'll be crowding of the cells. The moment there is crowding of the cells, there is a signal which is produced. And this is a death signal which allows the cell to undergo automatic cell death. But these signals are also completely gone off in cancer cells, and they keep on overcrowding. They keep on invading the normal tissues, and that's how they keep on spreading. Okay, so what is important? I mean, there's many other things, many other questions which also come up is there are some people who smoke for 16 or 60 damn years don't get cancer. Some people who smoke for only 4 years or 5 years get cancer. It's also to do with your good genes. If you have efficient DNA repair genes, which can repair the damage caused due to tobacco or tobacco smoke, then the genes which are damaged are completely repaired by these DNA repair genes, and you are okay. You come back to normal. Whereas if these DNA repair genes are not so good, you don't know how to repair those genes, the cells undergo mutation and they become cancerous. So it also depends upon one's gene, basically, or to look at why some people get cancer with smoking, while some do not get this. Okay, and what are symptoms of cancer? So a lot of symptoms of cancer depending on the location of the cancer. It can be local swelling, local pain, bleeding, ulceration, having a jaundice or discoloration. Symptoms include weight loss, loss of appetite, fatigue, muscle atrophy, wasting of muscles, loss of weight, night sweats, anemia, and metastatic symptoms where if it is spread to other parts of the body, it indicates enlarged lymph nodes, cough, hemoptysis, enlarged liver, bone pain, fracture of the affected bones, neurological symptoms of cancer. Sometimes like ovarian cancer and all, it just occur just like that. It can be detected by chance only. By the time you have symptoms, the cancer already spread and already developed as well. Okay. So what are the causes of cancer? When you see here, these are the some important causes of cancer: tobacco, alcohol, lack of fruit and vegetables, red meat, lack of fiber in your diet, overweight and obesity. Okay, and lack of physical exercise, postmenopausal status, various infections, ionizing radiation, occupational hazards, and genetic causes as well, and some exposure for melanoma. Now, these can all combine together to increase the risk of different types of cancers. I won't go into details about it. And if you look at risk factors for cancer, the number one is your tobacco smoking. So tobacco can be also chewing tobacco. You can be there. You can snuff the tobacco. You can make it as gutka. You can make it as a quid. You can make it as a make it along with the betel leaves. Okay, so you can just snuff it inside your nostrils. Whatever you can do, you can do many things with tobacco, and depending on how you take in tobacco, you get cancer. Many people still have the belief that nicotine in tobacco causes cancer. Nicotine doesn't cause cancer. Nicotine only makes one addicted to tobacco. Okay, tobacco has got several end products which I come to, which can cause cancer because these cannot be metabolized inside the body, cannot be broken down in the body. They stay in the liver, the gallbladder, in the urinary bladder, and the urinary system, and they become cancerous over time when the immune system goes down, especially when you grow older. Okay, diet and obesity also significantly constitute for causation of cancer as well. These are some of the 56 end products of tobacco smoke, which when enter, which goes into the lungs, can get deposited inside the lungs, and they get deposited inside the bone, they get deposited inside the liver, and they cannot be thrown out of the body. They can't be neutralized, and they're there to stay. Okay, a person who has taken tobacco for about 2 years, and you better quit tobacco. But over the long run, when he grows old, he may still get cancer because those products are still inside his body. Okay. So how many of these cancers are preventable right now? So all this said and done, we still know the answer for only about 40% of the preventable cancers. Okay. Only 40% of these cancers are caused due to these risk factors which I told you about. Okay. Half of which is caused due to smoking alone. And remaining 60%, we don't know why the cancer comes. This is because the cells are constantly dividing inside the body. There are mutations happening inside the body. And this is chance mutation, which it happens triggering these oncogenes or tumor suppressor genes. Then you had it. Okay, which is chance of this mutation which occurs. So that is why we say that even though you might be leading a good life, that mischance, the chance of the mutation is the one which is causing this particular problem, can lead to you getting cancer. So it won't take one mutation to get cancer. It requires several mutations to get cancer. So initially you have dysplasia, then it becomes metaplasia, and then it undergoes anaplasia kind of thing. So these are risks from smoking. I won't go into details of all this. So cancer is inherited mutations. I said to you, ovarian cancer, stomach, breast, prostate, lung, glioma, head and neck, endometrial, etc. in the order of their preference. Ovarian cancers usually run in families, and you can see the incidence of the ovarian cancer, the inherited mutations of ovarian cancer is quite high. So once you have cancer, what happens? I'll now come to the topic of yoga here. So the only way of killing or removing the cancer or having a curative intent is to do surgery. So the cancer is localized, not spread anywhere, and you can easily remove it. Please remove it. That's the best way to treat cancer, because radiation and chemotherapy, even though you give radiation and chemotherapy, cancer cells die, but there are some lurking cells which have become resistant to radiotherapy and chemotherapy. They resistant cancer cells start giving rise to new offsprings, and they form new cancer again, relapse cancer again. So there are also what is called cancer stem cells among the cancer cells, which are resistant to chemo as well as radiation therapy, and they give birth to new daughter cells. So what is important is early diagnosis. Okay, if you go to the doctor very early with proper checkup, and if your cancer is still localized, best thing is to do surgery, throw it out of the body. Okay, if you are not able to do surgery, if you are doing chemo radiation, chance of recurrence rates are quite high, and because these are not called primary treatment, these are called as adjuvant treatment. In the sense, after surgery, you may remove cancer, but you're not sure the cancer is gone. You still do chemo and you still do radiation also. And you do chemo radiation as upfront therapy only when you want to reduce the size of the tumor, or you know that the intent is not so curative. Except for some hematological malignancies where chemotherapy works as a first line treatment, most of the solid malignancies, surgery has to be done. Okay. So when you see all these treatments when the patients undergo, there's huge amount of side effects of these treatments. One is fatigue. More than 90% of the patients have fatigue. 59% of them have anemia. 90% have nausea, emesis. 56% of them have constipation. For example, morphine when you take reduce pain, you also tend to get constipation. and 23% of them have diarrhea, 53% have cognitive impairment, and so on. And all these symptoms during treatment can also cause extreme distress. This treatment can result because of the cancer spread to other parts of the body, or it can also be because of the cancer-directed treatment, which can cause low blood counts, which can cause electrolyte disturbances, and all these things which can cause all these symptoms. We did a study right in HCG Cancer Hospital. We integrated yoga into cancer patients, breast cancer patients undergoing surgery, radiation, and chemotherapy. And these we are looking at how does yoga help in improving symptom control, help in managing mood states, reduce stress hormones. How does it help in improving the immune response uh, in these patients? This is a study which we did over time, and very importantly, even before I wanted to go to the study, it's very important to understand. Many patients, when we started meeting in the hospital, they were talking about stress. They were asking one simple question: does stress cause cancer? We never had this solution. We never know whether really stress really causes cancer. We certainly know that stress is one of the promoters of cancer. How do we know this? Because of a big study done and published in 2006 in Nature Reviews Cancer, where they did a small experiment on laboratory mouse models. They injected breast cancer cells into the footpad of the mouse, and one group of mouse they gave electric shocks during when they're supposed to go and have food. The other group of mouse they also gave electric shocks, but they gave beta blocker which can minimize the effects of stress called propranolol. The third group of mice they didn't do anything. Okay. And what they saw was the group of mice which was exposed to the stress or electric shock died within 15 days. Group of mice which was exposed to the electric shock with the beta blocker, about 50% of them survived. Okay, and the group of mice which did not have any stress, all of them survived. Okay, this goes on to show that though we don't know whether stress can cause cancer, we really know that stress can exacerbate the progression of cancer. And this is very true with all the meta-analysis that has shown that patients who have depressive symptoms or do have over depression, they have high mortality rates compared to those who don't have. Okay, so we did a lot of studies to look at what can be done to improve the quality of life of these patients. And we know these are some of the areas in oncology where modern medicine doesn't have any solution. For example, you have to give radiation, but by giving radiation, you cause oral mucositis. You have to give chemotherapy. By giving chemotherapy, you cause nausea and vomiting, and you cause low blood counts. Then you also have fatigue, difficult symptoms to manage in cancer, especially fatigue, anorexia, loss of appetite. You have no medicines for that. Twins or multivitamins or B complex, all these things really don't help in this case. You have constipation, you have dry mouth, xerostomia, you have neuropathy, bed sores. So all these are some difficult symptoms which cancer patients experience because of their treatment. And we also have malignant wounds if the cancer skin, and it can also have impact on quality of life and emotional well-being. So we want to look at whether these Ayush therapies really help, and we found some reviews in Cochrane Library collaboration where they found that yoga has a significant effect in cancer patients. And what is the role of yoga here? We found integrate yoga in surgery to help in post-operative wound healing. It improves immunity following the surgery. It helps in reducing anxiety of surgery. It improves quality of life patients undergoing surgery. Okay, and it also reduces myofascial pain after surgery. In chemotherapy, it is known to reduce depression, anxiety, manage nausea and vomiting during chemotherapy, reduce fatigue during chemotherapy, and radiotherapy is known to be very, very useful, especially head and neck cancer, in speech articulation, especially oral cancers. When they undergo radiotherapy, they get trismus of the jaw, not able to move the jaw properly, not able to talk properly, okay, because of mucositis and other things. And this radiotherapy, yoga is known to really help people get back their speech as early as possible after radiotherapy. And then in supportive care, when the patient is already discharged after finishing the treatment or they have a relapse of the disease, yoga plays a very, very important role in pain management, or constipation management, and fatigue as well in patients. There are so many things which can be done. I will not go into details regarding research studies here, but I'd like to share that what kind of yoga can be done. So you will also learn some amount of yoga after my class by Dr. Sapna, but what can be done safely by cancer patients is very, very important. Now these patients already are sick. Okay, patients already are sick. They receive cancer-related treatment like surgery, radiation, chemotherapy. They have fatigue. They already have anemia because of cancer per se, and also because of the chemotherapy and other things which can reduce the blood counts. Okay, so all this being there when the patients are in an acute condition, can you really do yoga? So what kind of yoga to be done in these patients? So what we have seen is breathing exercises and pranayama plays a very important role in these patients. Basic asanas can be done, simple asanas, no acute bends, no inverted postures should be given, no hyperventilation techniques like fast breathing should not be done for these patients, especially if they have the cancer has gone to the lungs, they're receiving radiation for the lung metastasis, etc. It can lead to pneumothorax. You should not do any dynamic practices because if the patient has low blood counts, the patient has fatigue, if the patient has low sodium levels, they can have syncope attacks, they can faint and then fall down, and they can injure themselves. So we give a lot of relaxation techniques, give a lot of meditation, mindful practices. And whenever we do a yoga program for cancer patients, we look at what is the concern of the patient. Is it stress? Is it anxiety? Is it fatigue? Is it myofascial pain? Is it speech articulation? Is it nausea, vomiting? Is it fatigue? We look at all these conditions, and based on that, we tailor the uh, yoga for the patient. And we also have to be very careful when the patient has low blood glucose, if the patient has osteoporosis, thinning of the bones because of hormone therapy or aromatase inhibitors. Okay, those who have low blood glucose levels because of the increased intake of medications and less intake of food, brain metastasis, spine metastasis, so deep vein thrombosis in the calf muscle. So all these things you need to really look for when you start dealing with patients with cancer. It is not a simple thing where anybody with the cancer is asked to go to a regular yoga class and do the yoga. It may do more harm than good to the patient. So this is my advice on yoga. So we have found a lot of evidence in research for different aspects, for different symptoms like headache, fatigue, neuropathic pain, constipation, insomnia, sleep disorders, obesity, cancer, asthma, allergies, arm lymphedema, anxiety, and depression. So all these things can be really taken care of by using yoga approaches. We have had several research projects, published several papers in this area, and it's already a part of certain guideline document in oncology care today. Okay, and this is it regarding my thing on yoga. If you have any questions, I'll be happy to answer.
Thank you, sir. I would request participants who have had the opportunity to listen to Dr. Raghavendra Rao's talk to drop in their queries if they have any on the chat box, and I will pick it up from there. While we wait for questions, I personally wanted to know this. Okay, there's already a question there. Can you provide some details of the studies done at HCG on effect of yoga?
Yeah. So we have done almost about 6 to 7 studies on yoga intervention in cancer patients, especially with breast cancer. So one of the first studies was looking at the whole course of treatment of breast cancer patients undergoing surgery, chemotherapy, and radiation. The 6 months intervention. So one arm was receiving yoga, another arm did not receive yoga. We saw various aspects. We looked at wound healing time, how much time it took for suture removal, how many people had some complications like sepsis inside the wound following surgery. We looked at how is the blood counts normalized very fast after surgery. We looked at inflammatory cytokines like TNF alpha. So even after 4 weeks after surgery, if inflammation is still persistent, it leads to delayed wound healing. So what is important here is the patients have to bounce back immediately after surgery. And if you are able to do the chemotherapy immediately within 2 weeks after surgery, your response rates are better compared to a patient who is receiving chemotherapy about 4 weeks or 6 weeks after surgery. Okay, so these are all some of the important aspects where we looked at how does it help in surgery, post-operative recovery. We also looked at how does it help in chemotherapy-induced nausea, vomiting. We found that yoga helps in reducing nausea, which is caused due to chemotherapy drugs. So you have very good antiemetics to stop vomiting, but by stopping vomiting, you're causing nausea. So yoga plays a very important role in reducing this nausea as well. And then we looked at fatigue, looked at salivary cortisol rhythms. For example, early morning we all have energy, right? We all feel better when you get up early in the morning and start doing our work and our chores. Energy is because of the hormone called cortisol, a good hormone. And this hormone is cyclic in nature. It's very high in the morning and it tends to come down by evening. But in cancer patient, what happens is because of the repetitive stress and distress they're experiencing throughout the day, this cortisol level, which is high in the morning, is flat or high throughout the night as well. And this doesn't allow them to sleep. They become restless, can lead to insomnia. So what we found was decrease in this cortisol rhythms, as well as abnormal rhythms, as well as decrease in mean cortisol slope in these patients who underwent yoga intervention. So by reducing the distress, it becomes very, very important for these patients. For example, most of these patients we have seen, they don't accept that they have cancer. They go for a denial, then they go for anxiety, they go for bargaining with the doctor saying that I don't want chemo, I don't want this, I don't want that. Okay. Then they undergo, after everything works out, they have depression. Okay. And they have a lot of anxiety about uncertainty of the relapse of the treatment. Whether after treatment, whether the cancer is going to come back to me or not. Because when they come to the hospital, they meet other patients who are same breast cancer patient, the OPD. The patient would have told her, I took a treatment about 3 years back, now again I got it here in the brain. Okay, so these things really disturb these patients, and this uncertainty, the uncertain trajectory of the disease can be a one thing which is always on their bank of their minds. And this needs to be taken care of by using yoga approaches. That's what we do. We do a lot of counseling with these patients. We allow these patients to calm down their mind. That's very important. Otherwise, thoughts keep running in their mind all the time. And this really plays a very important role in improving quality of life of these patients.
Thank you, sir. Sir, we have one more question. You did speak about how yoga can be used in cancer symptoms management. But this is even before that, like how you did talk about risk, family cancer being a risk factor. Are there any suggestions for people with family cancer history? Are there some asanas that you could suggest that family of cancer patients follow from young age itself?
See, again, even when you look at familial history of cancer, it's not that it has to really pass down to their offsprings. Okay. So I said to you, the incidence is only 5 to 10%, not more, not more at all. Even among those 5 to 10%, it really doesn't go into their offsprings all the time. Okay. For example, BRCA1 mutation, BRCA2 mutations, which are there. Some people may have that. And I don't know if you have looked at some of the celebrities, you've seen them chopping off their breasts just because they have this burger habit.
I think there was some issue on Dr. Raghavendra Rao's end. Um, Sir, are you there? Hmm, looks like we've lost him. Uh, Dr. Tanveen, would you be able to quickly call and check if he can join again?
Sure, yes.
Thank you. Apologies for the glitch. I think this is Murphy's Law, as always. Uh, please stay back. We have a session starting in another 5 minutes. Dr. Sapna is going to demonstrate desk yoga techniques for us. Kindly stay back. You'll also get answers to your questions. Dr. Sapna, are you on board?
So maybe we can start with Dr. Sapna when Dr. Raghavendra comes, right? We can.
Dr. Raghavendra is joining in a minute through his phone. So,
Am I audible?
yes.
Yes, Dr. Sapna, you are audible. You
Okay.
can share your video also if you're comfortable doing that.
Yeah, I think Dr. Raghavendra is joining. So maybe.
Meanwhile, people who have joined, you can see in the chats, Dr. Nandita has shared a link for our home screening appointments. You can book appointments there. And if you have any questions regarding Niramai or yoga, you can always mail us and we'll be happy to clarify. We can also forward your questions to Dr. Raghavendra Rao in case you don't get to talk with him here or interact with him here.
I see sir is here now. Okay.
Okay, he's back.
Sir? Yes, he's back.
Am I audible now?
Yes, sir, you are.
Sorry. Okay. I think I lost the connection on my laptop here because of
Yes,
the
sir.
connectivity problem. But I joined through the mobile. So I was just saying, I was on the 1 second. All right. Yeah.
Yes, sir, we can hear you and we can see you as well.
Just keep, doesn't matter. Just take that out. Okay. Okay. So basically, there are yoga can be done. They need to be physically active. See, for example, they are said very clearly with all the physical activity guidelines. 30 minutes of moderate physical activity, if you start doing every day in your life, 17.5 kilocalories per kg body weight. If you are able to expend that much amount of energy per week, okay, that's almost around 2000 kilocalories of energy, we say. If you're able to do that much, that's great, because every day you take in 2000 kilocalories of energy by food. All they're asking is you spend the same amount of that what you take every day in 1 week. And if you're able to do that by at least having half an hour of physical activity every day, like walking, jogging, whatever it is, a moderate physical activity, that is not just only going to prevent these hereditary cancers from coming, but they also can stop you from getting heart disease or diabetes or obesity or other kinds of diseases as well. Okay. So these are some of the lifestyle things which you really have to adopt and lead life, because everything is like a chance. You walk on the road, a vehicle can come and knock you off. So the probability is 50-50. So life itself, the probability is 50-50. So don't worry about anything.
Thank you, sir. I think while the 2000 calories did sound like big, but when you say 30 minutes, it does seem doable. We have a question here by Seema Singh, who has asked, what's the precaution for breast cancer in yoga? I think sir did explain that the precautions that are there cover for all diseases, but I'll still let sir answer that.
Okay.
So what are the precautions for
Basically,
breast cancer in yoga?
yeah, basically what happens here is patients with breast cancer, the moment they undergo surgery, if they have a right-sided breast cancer, they undergo surgery there, they tend to not move that region at all. Okay, they feel very protected about the region. They feel something has happened there. They don't move the region at all. So improving mobility in that particular region will prevent lymphedema. Okay, will help in preventing, will help in proper healing of the wounds. Will prevent myofascial pain from occurring. So all these things have to be done. Okay, the precaution I said to you is if you only when you have a bone metastasis or spine metastasis or brain metastasis, you should be careful. Okay, and if the breast cancer is completely gone, it's removed, you are free to practice anything you want to do. But the only thing is avoid acute bends, avoid hyperventilation practices.
Okay, so what are hyperventilation practices? Anything that
For example, you must have seen Baba Ramdev doing fast breathing techniques. Okay,
okay.
throwing
Right,
the air from blowing of the air, that those
right.
things should not be done.
Okay. Thank you, sir.
Anything, your normal respiratory rate is about 13 to 16 per minute. And if you are increasing your respiration to more than 20 per minute, then it's a problem.
Okay. Thank you, sir. I think that's a good takeaway we have here. Uh, so thank you, sir. I think there was a very okay. There's one more question, and I think this is very generic, but something that all of us have had probably in our mind. Can women do yoga when they're on their menstrual period?
See, yoga is when people understand yoga as only asanas. That's the wrong conception. Yoga can be relaxation technique, can be breathing exercises, can be pranayama also. You can easily do the pranayama, you can do relaxation techniques, or you can meditate. You probably will not be doing the asanas, but you can do standing asanas, slight bends, it can be done. That should not be a problem at all.
So for women who do not really have, I mean, the very few, but who do not have experience any physical problems during their menstrual cycle, is that okay for them to do the asanas, or you're
Not all
telling
the
that
not
only?
not the forward bends or not the acute bends. Simple asanas like side bends, Ardhakati Chakrasana can be done. Okay. And Vajrasana can be done, Padmasana can be done, Vakrasana can be done. The small asanas which don't have forward acute bends, which don't put pressure on the abdomen, those can be avoided. Okay.
Okay.
The only thing what can happen with the dangers of that is you could have increased flow. That's all.
Right, right. Thank you so much, sir. There's one more question. Can cancer recovered patients do all the asanas, or should they also follow restriction in the asanas?
They can do all the asanas, nothing to worry about it.
Right. Are there any yogas for preventing COVID or for caring COVID patients?
Yeah, that's a very good question, but that's a different topic altogether. And we have been doing a lot of these things in AIMS, Jajjar, AIMS, Delhi and all. We've been doing a huge activity on using yoga intervention in COVID. And breathing exercises of pranayama plays a very, very important role. We are looking for oxygen concentrators outside, but we have the same oxygen concentrator within our body. That is our lungs. So if you learn to do the proper art of breathing, that is going to be very, very preventive, and that can prevent any exacerbations of COVID in people who are already affected with COVID.
Thank you, sir. Thank you for the very informative session. We look forward to more engagement with you and hearing more from you.
Thank you.
Yes,
I have
sir.
to excuse myself because I have to leave. I have to join for another meeting at 5 o'clock. Okay.
Thank you, sir. Thank you so much, sir.
Thank you, sir.
Thank you. Thanks.
Thank you.
Excellent talk. Thank you. So we still hold on, right? Audience, please stay.
Yes. Yes, please. Dr. Sapna, you made a co-host. It's all yours now. You can take the floor and teach us how to do desk yoga as what I've been told. I'm excited and looking forward to it.
Okay. Video clear? Is my video clear?
Yes, Dr. Sapna, clear.
Am I audible?
Yes, you are audible. Although I can sense a slight break in the voice, but I think it's fine.
Okay. So we're good to start?
Yes, Dr. Sapna, it's all yours. Do you want people to switch on their videos, or are you okay?
If they are comfortable switching on their camera, well and good. I'll be more comfortable.
Yeah. So everybody, people, Dr. Sapna will be actually demonstrating, and I believe we can do it along with you, Dr. Sapna.
Yeah, definitely. If
So if you want to do it, if you're comfortable switching on your cameras, please do. We'll try and also put the theory into practice after having that lovely session. I think we need to imbibe and practice it as well.
Okay. So we'll start.
Yes.
Yeah. First of all, thank you so much for inviting me to take this session here. Thank you to the entire team of Niramai. Thank you to Dr. Tanveen. She coordinated everything with me. Thanks a lot. And of course, my thanks to Sir as well for giving me this opportunity. So I'm going to be quickly taking you through some of the yoga practices that are given for patients. I personally deal with cancer patients, giving them yoga. So I've worked under Dr. Raghavendra Sir, and he's been guiding me on what yoga to be given and what not to be given. So I've been dealing only with cancer patients. And breast cancer is one study that is being done in a very large scale at our hospital, that is in HCG. So we're basically looking at cognitive functions, and like Sir has already explained all of it, so I won't go into detail on that. So I'm going to be telling some of the practices that will be helpful to manage certain symptoms. Okay, so we will start the session. Kindly stop me if I'm not audible or if I'm not clear, so that I can repeat again. Okay. So first, for any patient who is diagnosed with cancer, not just breast cancer, any cancer, very important practices will be breathing exercise. So I'm going to be demonstrating it to you today. So first practice, you have to sit comfortable, make yourself comfortable, clear your bowels, bladder, and make yourself comfortable. Wear a very loose clothing, preferably a cotton clothing. And it shouldn't be stiff. Even your pants should not be really stiff. The more comfortable it is, the better it is. Okay, so the first practice is called hands in and out breathing. So you will place your palms on your shoulder. Okay, you'll, if possible, touch your elbows in front. If not, no worries. So what you'll do, you will breathe in and open up both your elbows sideways. Okay, and you're going to expand your chest. You're going to breathe out and bring your hands forward. Okay, very simple. You just breathe in And simultaneously open your arms sideways, expand your chest, breathe out and back. Okay, for one last round, we will do it. Breathe in, take in as much as oxygen you can, breathe in and breathe out. So this is the first breathing exercise we will do. The second breathing exercise is called hand stretch breathing. So you'll interlock your fingers, you'll place it over your chest. And when you're placing it here, do not raise your shoulders. Unconsciously, we just raise our shoulders up. You want you to relax your shoulders. Okay. And now you're going to breathe in and stretch your hands straight in front. Okay. And when you're stretching, see to it that you stretch from your back, from your upper back. So you stretch it completely and your elbows should not be semi-bent. It should not be flexed like this. You're going to stretch your hands completely. And you're going to breathe out and place your palms back on your chest. Okay. For better benefits of these practices, it will always be good if you can close your eyes and perform. Okay, so we will do it. Breathe in and stretch your hands straight in front. Breathe out and back. Shoulders relax. Once again, breathe in, stretch completely. And breathe out. This is the first practice in hand stretch. Next is the same hand stretch breathing. Now, instead of stretching at the level of your chest, you're going to stretch at the level of your forehead. Okay, so this level. You're going to stretch at the level of forehead. You're going to breathe in and breathe out. But see to it that you do not lift your head up. Your head is going to be in neutral position looking forward. So you're going to breathe in and breathe out. Okay, very good. Last count, breathe in and breathe out. Okay. So this is the second level in hand breathing. In hand stretch breathing is the same thing. Your hands will be on your chest, and now you're going to raise your hands completely up. Okay, and when you're raising your hands up, see to it that your palms are facing towards the sky. Okay, your palms will be facing upward, not this way. The palms will face towards the sky. So you're going to stretch yourself completely and breathe out and back. Once again, relax your shoulders. Breathe in, stretch completely, give a complete upward pull. Breathe out and back. Okay. So there are these three variations that we did now. First one was this breathing, called hands in and out breathing. Next is hand stretch breathing. We did it at the level of chest. Next at the level of forehead, and then above your head. Okay. These are very important. It looks very simple, but these breathing exercises do a lot of difference in the body. Patients feel really better after doing these practices. Okay. Now, I would request all of you to stand up. Okay. Now, I'm going to demonstrate you one particular practice. You will need a chair. Now, you stand, so you have this backrest of the chair, you stand behind it. Now, stand a little far, probably about your hands width. Now, you're going to breathe in, take both your hands above your head, give a backward bend. Now, you're going to breathe out and bend forward and catch hold of the chair backrest. Okay, and slowly you bend forward. Slowly you bend forward. See to it that you don't bend your elbows. Okay, your elbows will be really straight. It's just that your body will bend forward. Okay. So I'm going to demonstrate this once again. You stand behind the chair. You're going to breathe in. Raise both your hands, give a backward bend, and then breathe out and bend forward. Okay, you're not going to bend your knees will be straight, and then your elbows will also be straight. Then you look down. Okay, now from here, there is a breathing that you will have to follow. So you breathe in and look up. You breathe out, you look down. Okay, so you breathe in and look forward, breathe out and look down. Right. Very good, very good. Breathe in, you look forward, breathe out, and you look down. Slowly come up. You can either give a backward bend, okay, and then you can release your hands. So this particular practice is helpful instead of directly bending forward. Like Sir said in the webinar, that you should avoid acute bends. One of the bend is this. This is called Padahastasana, wherein you bend completely forward. Okay. Instead of that, you could always do with the support of a chair. Okay. I hope I'm clear. Practice. So the next practice that we're going to do is instead of facing forward, now you're going to face your back towards the chair. That is the backrest of the chair. And now you're going to hold the chair backrest, and you're going to push your hip forward. And come up. You're going to push your hip forward, breathe in, look up, breathe out, and come back. Breathe in and breathe out. Okay. Now, this is again a variation. Instead of doing it actively, like the actual practice is you hold you place your hands behind your waist and then you give a backward bend. So there are yes, ma'am, you did it, doing it very well. But there is chances of some of them experiencing a little giddiness when you give a backward bend. So this also can be avoided by taking support. Okay, so then you'll feel more comfortable and there's more concentration on the breathing. So that's why this chair support will really help. Okay, so I hope I'm clear. Now, next practice. Okay, next practice is again bring the chair. Now you're going to face side of your body towards the chair. Okay. Now this is called Ardhakati Chakrasana. Now you're going to, the backrest of the chair is there, and now you're going to just slide your hand towards the side of the chair. Breathe in. The breathing, it is a really, it's sometimes confusing. Patients say that they're not able to actually remember, how they have to breathe. So one simple trick that I would like to tell you is whenever you're bending, okay, sideward bending, forward bending, or backward bending. Whenever you're bending, see to it that you breathe out. Okay, whenever you come back to the normal position, you will breathe in. Okay, I hope it's clear now. So now we are bending sidewards. So it means you're going to breathe out when you're going to bend. And then you come up, you're going to breathe in. Okay, so in this way, you can take support also if you want. And then breathe out and breathe in. Okay. The same way, we'll do it on the other side. So you will do it the other side as well. You will breathe in and you will breathe out. You breathe in and come up. Now, there is another variation that you can do is you can raise one of your hands. The side, the hand which is touching the chair will be holding it. The other hand, you can raise it up and then give a backward bend. This also can be done, but if you're in initial stages of chemotherapy or radiation, you might be experiencing severe fatigue. So then you will not be able to do this. Instead, you can do this simple practice. Okay. So we've done forward bend, we've done backward bend, and we've done sideward bend. So this is very simple, I believe, and you'll be able to perform it. Now, Next is for majority of the patients who are undergoing chemotherapy will experience constipation. There will be disturbances in your bowel movements. So one very effective practice is called Bhajrasana, for which you will have to sit over your heels. So this is basically the practice. But not all of us will be able to sit over our heels so comfortably. So what you can do is you can take anything. I'm taking a pillow. Okay, this is like the most comfortable one, which is easily available. You need not spend anything. So you can take this pillow and you can place it beneath your.
We can see, Dr. Sapna, we can see.
Okay. So you can place it beneath your, on top of your leg, that is over the ankle joint, and then you can sit. Well, this is equally as effective as the one you do without this support. Now, this is a very effective practice for bowel movement, okay, for inducing bowel movements. So this is effective if you have complaints of constipation. After consuming food, you can always sit in this asana. This is called Vajrasana. Okay, you can sit for about 5 minutes, 10 minutes, how much of a time you're comfortable with. Okay, but if you have knee pain, if you have osteoarthritis, please avoid this. Okay. So these are some of the simple asanas that I've told you in sitting position using chair, which should be very comfortable. Likewise, there are certain asanas that you can do in supine as well. Most effective one will be Shavasana. Okay. When I say Shavasana, I can see people have that sort of nice feeling that okay, I get to sleep. But Shavasana is not about sleeping. Okay, it's about becoming aware of your body. When you lie down on the floor, what happens is that none of your muscles are active. Even when I'm sitting this way, there are some of these muscles which are working against the gravity. I'm sure all of you know there are these back muscles and leg muscles. But in Shavasana, there are no muscles that are actually acting. Entire muscles of your body will be relaxing. I'm not speaking about the internal muscles like the cardiac muscles and all of that, but all of these physical, like the leg muscles, thigh muscles, and all of that, they will be resting. So it gives you tremendous relaxation. Just lying down in Shavasana, say for about 5 minutes, you'll be able to see that your blood pressure will come back to normal, your pulse rate will come back to normal, and your breathing will always come back to normal. Okay, so just lie down in Shavasana. When you're lying down in Shavasana, it's important that you separate your legs apart. If this is my leg, so I separate my legs, my hands apart, and my palms should be facing upwards. Okay, and you can place your head in any comfortable position, but always close your eyes when you're in Shavasana. Okay, so this you can practice for like 5 minutes every day in Shavasana. Okay, now another thing that people say is when you lie down in Shavasana, they go to sleep. Okay, they do not know, they do not want to sleep, but they go to sleep, unknowingly. So what to do for that? So a simple technique is there is a relaxation technique which all of you can do in sitting. But this is very effective when you do it in Shavasana. But I will teach you how you can do it in sitting so that you can do it in spine. So first, I want all of you to sit in any comfortable position, like sitting on chair or on floor. If you want back support, anything. Just see to it you're comfortable. Okay. Now, after that, you have to close your eyes and just listen to my instruction. Okay. Close your eyes. You have to bring your complete awareness at the tip of your nose. Entire awareness, your entire focus is at the tip of your nose. Just observe the breathing that is happening through your nose. You can see that the cool air from outside is entering your body, and hot air from inside your body is coming out. Cool air enters your body and hot air comes out of your body. You have to just observe at the tip of your nose for 5 rounds. This will be stage 1. Now slowly place your right palm on your chest. Place your right palm on your chest Now, when you deeply breathe in, you can see that your chest moves forward. And when you breathe out, it goes back. When you breathe in, you're filling your lungs with oxygen. When you breathe out, your lungs collapses, carbon dioxide is pushed out. Just observe this thoracic movement that is happening. When you breathe in, the chest moves forward. When you breathe out, the chest goes down. Now slowly place your right palm on your abdomen, on your stomach region. Now when you breathe in, your abdomen bulges forward. And when you breathe out, it goes back. Just observe this beautiful abdominal movement of yours. When you breathe in, your abdomen bulges forward. When you breathe out, it goes back. Just observe this. Slowly release your hand. Slowly open your eyes. So this is a relaxation technique. It is called as quick relaxation technique. Okay. Okay. I should have asked you to rub your palms. Okay. Anyways, thank you. Somdev Upadhyay. Okay, you did it. But I should have told you, to actually rub your palms and then do palming. But okay, so whenever you're doing it, like I said earlier, lie down in Shavasana, observe your breathing through your nose for 5 rounds. Now after that, we'll place your palms over your chest, observe your thoracic breathing for 5 rounds, and then place your palms over your abdomen and observe your abdominal breathing for 5 counts. So it'll be 5, 5, 5. Okay. And after that, we'll come back to Shavasana, and then if possible, you can chant Om. Okay. And Om does not have any significance to any religion. It is a universal syllable which has got a powerful vibration, a resonance which is created after chanting Om, relaxes your entire body and mind. So that way you can conclude by chanting Om. Okay. And then you can come back to awareness by giving palming and then placing it over your palm. Okay. So that way you conclude the relaxation technique. All right. Now, after you do asanas, you will conclude it with relaxation. Now, lastly, I'm going to be teaching you pranayama. Like Sir has already told about hyperventilatory practices. A lot of patients, the moment we say yoga, they say, I do Kapalbhati for half an hour, for 15 minutes, for God knows how many ever times or how many ever minutes they do. But please, if you've been doing it, kindly stop that practice. You can always do Kapalbhati, but do it under supervision, learn the correct way, and then you can do it, but not like for 5 minutes, 10 minutes or so. You can do it for 5 minutes and do not strain yourself. So that is one thing. Another hyperventilatory practice is called Bhastrika, wherein you do active inhalation and active exhalation. Again, do not practice it. So now I'm going to be teaching you a balancing pranayama, which is called Anulom Vilom, which is commonly practiced by majority of them. But for those of you who do not know it, I'm going to be demonstrating as to how you do it. So in your left hand, you will adopt this particular mudra. This is called Chin Mudra. The tip of your index and thumb will touch each other. The other 3 fingers will be extended. Place it on your thigh. On your right hand, you'll adopt a mudra which is used for pranayama. This is called Nasikagra Mudra. You will bend the index finger and middle finger. The other 3 fingers will be extended. All right. So always when you're doing pranayama, use your right hand. So your thumb will be to close your right nose, and your ring finger and your little finger will be to close your left nose. So the movement should come this way. Okay. So now what you will do is you'll close your right nose, breathe in through left, and you will close your left nose, breathe out through right. And once again, you will breathe in through right, close right, and breathe out through left. So this is 1 round. So you're going to start with left nose, breathe out through right. Once again, breathe in through right and breathe out through left. So this is one round. We'll do it once again. I'm going to tell it to you again. Close right, breathe in left. Close left, breathe out right. Breathe in right. Close right, breathe out left. Okay. You can do this for 5 rounds or 9 rounds. This is one of the most effective practice. If you do not have time to do all of these practice, at least if you can practice this one particular pranayama, this is called Nadi Pranayama, or it is also very commonly called Anulom Vilom Pranayama. So you can always do this particular practice. This is very useful for controlling some of the symptoms such as fatigue, headache. Okay, very effective. Now the next practice that I'm going to teach you is called Bhramari Pranayama, for which make fist of your palm. Okay, extend your index finger. You're going to close your ears. You're going to breathe in through both your nose, and when you're breathing out, you're going to produce a humming sound. That is. So you're going to breathe in through your nose, and when you're breathing out, you're going to produce this humming sound. So do this for about 3 rounds now. Right. So this particular pranayama is called Bhramari Pranayama because you will be resonating in the way a bee resonates. Okay, like a Brahman. So this is Bhramari Pranayama, which is useful for sleep. There have been extensive studies which is done on this particular pranayama, assessing the brain waves. So they have found out that it induces a very calming sort of a brain wave in your brain. It was found out, they found it out through EEG studies. Okay, so this is also very effective for inducing sleep. Okay, so I think you can start with loosening exercises, a simple loosening of your joints like head and neck movement, shoulder movements, hip movements, and knee and ankle. You can start with loosening exercise and then do very simple asanas like the ones I showed you with the props. That is, you can use chair or simple ones. You can do it in lying down position as well. Then you can do perform a relaxation technique. And lastly, you can conclude it by pranayama. Very important is these two pranayama. Okay, and sincere advice would be do not practice Kapalbhati or Bhastrika without guidance. Please take a guidance under a supervised, under a trained specialist, and then you can perform. So I think we will conclude the session. If there's any doubt, you can please let me know.
Sapna, I have a query.
Yes.
It was very nice. I practice yoga every day. So I learned something new from your session also. I have one doubt. Why you told that while stretching, we have to close the eyes, right?
Yeah. Yes.
Why is that?
Sorry, ma'am, I didn't hear you.
You told that while doing stretching exercises, we have to close the eyes.
Yes, ma'am.
Why we have to close the eyes?
Okay, ma'am, not just in stretching, any practice that you do in yoga, always if you do it with closed eyes, there is more awareness. What happens when I'm opening my eyes, I'll be looking at my hands, I'll be looking at probably my, my nails or something. So there is distraction. To avoid this distraction, it is always better you do yoga with closed eyes.
Okay.
Any practice that you do, unless it is a balancing posture, like Bhajrasana and all of that.
Yeah, that's what I was about. Yeah. I was about to ask that. Yeah.
So those balancing asanas, you won't be able to close your eyes. It requires a lot of practice and after years of being in yoga, you'll be able to close your eyes. But whenever you close your eyes, there is internal awareness. You're able to feel your breath. You're able to feel the changes that is happening. So the results will be very good.
Yeah, and it is more effective also.
Exactly, correct.
Thank you so much.
Thank you.
Thank you so much, Dr. Sapna. It was really an excellent session, as Dr. Geeta says. And I don't think we have any more questions. Yeah, it was amazing, and especially the thing that you made us do it. We'll remember it better this way, because just listening to it wouldn't have been as effective. So
one question, if I may, Tanvi?
Yes.
Yeah, excellent session, Dr. Sapna. This is here. So the asanas you taught today were mainly for cancer patients. So are there a couple of them which you would recommend for, general audience, try and be more healthy? I can't say prevent cancer, but be more healthy.
Yeah. So one, if you're not diagnosed with cancer, you just want it as for your general health. One best practice would be Surya Namaskara. That is one of the best practice when learned in the correct way with proper breathing. It will show you results now. Be it mentally or physically, you will be able to see the difference. But what happens? We learn it in a wrong way, or breathing is wrong. Something goes wrong somewhere. So we don't really get the benefits. But if you can practice Surya Namaskara every day for about 3 to 5 rounds with proper breathing, it is.
Does it have to be done in the morning or any time in the day?
Preferably early mornings are the best time, because Surya Namaskara, when you're actually able to do it in front of a rising sun, it's always very good, ma'am, because the sun rays are really soothing that time. Evening, of course, but morning times are most preferred ones. But if you do not have time, you can definitely do it in the evening.
Sure. Thank you. Any other questions?
We have one more, which says, are there any yoga asanas for diabetic patients?
Okay. Of course, there are many practices that you can do, especially in sitting. But I'll show you one in sitting on chair. There are practices which is done sitting on mat on the ground. But I'll show you a similar one in sitting. So what you have to do, sit in comfortable position, but you should have a chair which has backrest or which has a hand rest. Okay. Now I have a chair which has backrest. So what you'll do, breathe in, and you breathe out, twist your body and try to catch hold of the backrest. Okay. You'll twist your body and you will look back. But you see to it that your leg should be firmly on the ground. You won't lift your legs like this, or you won't twist your leg just because you're turning your body. Your leg should be firmly on the ground. It's just your trunk that should be twisting. Okay? Yes. So again, the breathing will be, you'll breathe in, look forward, you breathe out and twist. And whenever you're maintaining any of the asanas in its final posture, now the final posture of this particular asana is this. So when you're in this posture, see to it that you do not hold your breath. You'll have to breathe normally. Okay? Holding breath is not advised. It is only for advanced practitioners. But as such, therapeutically, do not hold your breath in any of the practices. You will breathe in and you'll breathe out and twist your body and look back. Once again, breathe in, do it on the opposite side. Breathe out.
Is this equivalent to Vakrasana?
Yes, I was about to say that now. Vakrasana, this is equivalent to Vakrasana and Ardha Matsyendrasana. Those two asanas are meant to be stimulating to your pancreas. There are studies which have shown that the glucose levels have come down after these two practices. So instead of doing it on floor, I've showed it in sitting. So it is also somewhat similar, Vakrasana and the other asana that I said, Ardha Matsyendrasana. They're similar to this, but this is a modified version.
Okay.
So this is useful, ma'am.
Okay, thank you.
Anything else? Okay, I think that's all. I think.
Yes, I
Oh,
think
sorry,
that is
I'm
it.
speaking
Yeah.
and I was mute. Sorry. Yes, I think, yeah, that's all the questions. And it was wonderful having you here, Dr. Sapna. A brilliant session. And for everyone else, if you want to explore more about Niramai, we have our website, www.niramai.com. You can see there as we have upcoming webinars. And for Dr. Sapna, she's currently at HCG. So if you want more guidance, you can reach out to her.
I wouldn't actually invite them to that hospital. That is the least place I would invite anybody.
Email ID is with me. You can ask me. You can reach out to me, and we can circulate her email ID or contact details for her guidance. And yeah, I think that's all from our side. Thank you so much, Dr. Lakshmi.
Yeah, thank you, Tanveen. And thank you, Dr. Sapna. It was an excellent session. To get people to do it along with you, I think that itself is an attestation that we did enjoy it. Thank you. Thanks a lot. And thanks to everybody who were part of it until now and did not drop off. That's another attestation, Dr. Sapna, that people did enjoy the session. Thank you, everybody. Stay safe, stay healthy. Have a happy weekend.
Thank you so much for giving me this chance. Niramai team, thank you. Thanks a lot.
Thank you.
Ma'am. Bye.